Hey Andrew, how you doing? Hey, so tell me a little bit about your problem you have today and what's going on with that.
So 6 weeks ago, I was playing basketball.
Okay.
And
Playing basketball. Love basketball.
I stepped right on somebody.
Okay.
As I was landing, and that caused my foot to come in. It was on my right foot, but I was
Right foot?
my left, and I came in like that. And I've had some problems with my ankle already, and it's still causing some pain.
Okay. You mentioned you've had some problems with your ankle already.
Yeah.
Could you elaborate? Like, has it happened before, or?
Yeah, I've had a similar problem with this on the same ankle last season.
Okay, last year.
It caused me to sit out for half of the season.
Okay, last season. So you mentioned you played basketball. So you're on the high school team then? Playing.
I think I just started my collegiate.
Okay.
Yes.
Awesome. So you've done this before. Kind of the same thing again this time.
Yeah.
And so that pain, when does it occur? Is it just while playing only? Is it when you're walking around?
It's really just when I'm playing. When I walk around, as long as I'm not running or I guess landing harshly, I'm fine.
Okay, running or landing.
Yeah, but yeah, just usually when I'm playing. But I've been using a brace and while I play, but I've definitely noticed that I can't cut as well, and it's definitely disrupting my performance.
Okay, besides the brace, is there anything else you've been doing to help alleviate pain or help your ankle?
Just the typical things that the athletic trainers tell me, like ice.
Okay,
rest.
ice is good. Rest?
Yeah, that's about it.
Okay. So what are you hoping to get from your experience in physical therapy? What are you hoping to get?
Well, I really just want this to get better. I don't know if there's a chance it can get better, but I really want to get a scholarship so that it can pay for school.
Yeah.
And I can continue playing basketball. So
yeah, so really wanting to play ball. I get that totally.
Right.
So is there anything else besides the ankle that you think maybe could be contributing to this, or is it just you think mainly in the ankle, or?
Not that I know of.
Okay.
I mean, I've been playing for a while. And
are you taking anything to help alleviate the pain? Any medications of any kind?
No.
Okay. No medications. No surgeries on the ankle, right? You just had the ankle injury, but no surgeries on it?
Yeah, it's just been wonky since the first time.
Gotcha. So your main concern is being on the basketball court. If I'm understanding what you're telling me correctly, you want to get back to the basketball court. That's where you're having most of your difficulty with your ankle, and you mentioned that it's when you run and when you're landing on it. And what you've done to help alleviate some of that pain is the ice and resting. Have you noticed that the ice and rest helps?
It definitely did in the beginning, but right now I feel like
Just
it really does.
keeps bothering you.
If anything, it just helps with the pain. But
okay. Is there anything besides basketball that it's preventing you from doing that you would like to do?
no, I just want to get my
Basketball's the
scholarship.
main thing.
Hopefully, basketball.
Okay, I hear you. That makes sense. So it's a good thing you're here today. I'm excited to work with you. I want to take you through a few tests that we'll do just to see what exactly is going on with this ankle, so we can then do some exercises and some stretches that will hopefully help strengthen that to get you back on the court feeling normal again like you were before. Okay? So first, what I'm going to have you do, if you could take your shoes and your socks off. Is that okay?
Yeah.
And again, I know some of the stuff you mentioned hurts when you walk on it and things like that.
Yeah.
You may feel a little bit of those same symptoms as we're going through some of these tests, but it's to help me really identify exactly what's going on so we can then help it get better. Is that okay?
Yeah.
Okay, so I'm gonna have you stand up. And first what I'm gonna have you do is you could just walk on your, go ahead, yeah, that's fine. You walk down, go ahead and walk back. Okay, and then if I could have you walk on your heels like this, all the way down, and then back.
It's just a little painful.
A little painful there? Yeah. Okay. And now let's try to go up on your toes and walk.
Still a little painful.
Painful, okay.
Manageable.
Okay, heels and toes, painful. Gotcha. Now what I'm gonna have you do is I want you to just kind of put your feet together, hands inside, and then I want you to squat down, kind of as far as you can without pain. I'll be here to help you so you don't have to worry about falling over or anything. How's that?
That's alright, just a little
okay.
painful.
A little painful still.
Like, feels a little bit unstable, but
A little unstable.
I feel like I compensate with it.
Like you're having to put more weight on that left?
Yeah.
Okay, that makes sense. Here, let's have you walk out just a little bit. I'm gonna have you do it on this unaffected side, so it's your right ankle, correct?
Yeah.
So I'm gonna have you stand on just that ankle by itself with your eyes open, and we're gonna count to 10. 1, 2, 10. Good job. And then we're gonna go with your eyes closed. Okay, 1, 2, 10. Good job. Now we're gonna do the same thing on your right foot. Is that okay?
Yeah, we can try.
Okay, let's try it. So let's go on that right foot. Okay. Okay, that's okay. Let's step down. Now let's try with the eyes closed. And I've got you here if you need any help. Okay, that's difficult to do. Gotcha. Okay, that makes sense. Awesome. So now what I'm going to have you do is I'm going to have you go ahead and sit down right here on this table. Okay. And we're just going to, like I said, just do a few more tests to see what exactly is going on. I didn't ask you before, but is there any like numbness or tingling or anything associated with your ankle injury?
No.
Okay,
Nothing
so
like that.
nothing like that. We're fine. Okay, good. So I'm just going to do a quick screen roll. If you can sit right there, and all I'm going to do is I'm going to place my fingers on the portions of different parts of your ankle and foot just to test that sensitivity. Are you okay if I do that?
Yeah. That's
All I want you to do is tell me if it feels the same or different from one side to the other. Okay. Okay. So, how's that?
Same.
Same? Okay. We're going to go right here.
Same.
Okay. And then we're going to come on this side here.
Same.
Same? Okay, awesome. All right, next what I'm going to have us do is let's get you in a comfortable position here. You can even actually let's just sit. We'll sit right there, and then we'll have you go over in just a second. So all I'm going to do is just take some measurements now of how far we can go with your ankle in different directions. We're going to do it on this side first, just to kind of show you what we'll be doing so you're prepared when we come over on this side. Is that
Sounds
all right?
good. Yeah.
Okay. So what I'm going to have you do is I just want to have you point your toes to the ceiling as high as you can. Good. This table's a little low. A little bit. Okay. And now, come right in here. All right, go ahead and bring that up again. Good. Okay. And then next I'm going to have you go ahead and go point your toes down to the ground.
On the chart, on the day form, I read that you're coming in for some ankle problems.
Yeah.
Can you tell me a little bit about those ankle problems?
Yeah, I was playing basketball a while ago, and when I jumped up, and when I came down, it kind of landed on somebody else's foot, and kind of rolled my ankle a little bit.
Okay.
Okay.
And then,
Set 1 and 0. Nice. Now we're going to do the same thing on the other side. All right.
okay.
So let's bring those toes up again. About as good as we got right there. Okay.
Okay. So you are going to practice right now? though?
Yeah, I just feel like I can't really run or cut my fingers.
Okay. Not able to do it on there yourself?
Right.
Okay. Have you had any previous ankle injuries?
No, nothing.
5. All right. And then we'll go down the toes. Should be about 30 or 35. Okay. All right. I'll just make a quick note of those measurements.
Probably about 4 inches.
feel, is there any pain associated with those movements?
Yeah, just a little bit, both ways.
Okay.
But I definitely did feel a little more pain when it's a little more exposed.
Can
going
you
down.
can you kind of point to where that pain is when you're saying you feel pain? Where exactly do you feel?
Right around here.
Right in there? Okay. Okay. Gotcha. All right. Well, now let's have you slide back. You can even lie down on your back right there. And I'm just gonna actually do that one more time. Okay. The first time we did it with your knee bent, I want to see what it looks like with your legs straight.
Okay.
Okay. So we'll do it with this left one again. So go ahead. Let's actually have you. Can you slide down just a little bit? I can help you with this. And again, let's pull those toes up. Okay, and then down to the, or point your toes to the wall in front of you.
And mom and dad were able to like help you if you need it, or and then how far?
Got it. Okay, nice. Let's do same thing here. So right foot. Is that causing you that pain again?
Yeah.
Okay.
Just a little
Don't
bit.
do it too long then. Oh, sorry, I'm backwards here. Okay, and then point down to the ground.
Yeah, this is where it's more painful.
This is painful right here.
And what are your goals?
Okay.
What are you?
All right. Good. Okay, so we're just knock it down real quick again on that. Straight. And then we'll do one more where I'm gonna have you do, you can relax there, but I'll show you on this leg. So we're gonna kind of bring, I want you to kind of bring those toes this way as far as you can.
Okay.
And then the other way, okay?
Okay.
So go ahead and go in. Good. Just hold it for me.
If you're comfortable
There.
with it, if I can touch kind of like the bottom arch of your foot and center of your leg a little bit right here by your thigh, and then kind of up and down and swap on your ankle. Are you comfortable with that? Okay. Perfect. So the
Okay.
first thing
And then the other way?
here is I can just have you stand up and maybe just come stand kind of out in this area. And just stand like you would normally do. I'm just gonna look at some alignment.
Okay, let's go to the other side. Now let's, yep, in. Any pain with
Yeah,
that?
this is painful, kind of like when I pointed it down.
Okay,
Yeah.
gotcha. So this is kind of a similar pain.
Mm-hmm.
You mind taking one step forward for me just so I can be right here behind you?
Okay, let's go the other way. And how about this side?
This is
This is
not as
fine?
bad, yeah.
Okay.
Feel underneath.
Okay.
Any pain though?
All right, so while you're laying there, I'm just gonna go ahead and start doing some of our tests to assess some of the ligaments and structures in your ankle that kind of help maintain stability. So when you do land on it, it doesn't just roll.
Okay.
And so I'll test first this side to show you kind of what we're doing,
Okay.
and then you'll have a good idea of what we're gonna do on the actual side of your injured ankle.
Awesome.
Okay. So I'm just gonna be placing my hands right here, and then I'll be placing my bottom hand near on your heel, and then I'll be kind of sliding it forward. Are you okay if I do that?
That's fine.
Okay. So come right in here.
Any pain? Okay. Next I want you to do.
Okay. So that's kind of the feeling we'll be doing on the other side.
Okay.
Is that all right?
Yeah.
Okay. So go ahead.
Balance there. Perfect. Close your eyes and stay balanced there. Great. And now, do you feel confident enough to be able to do that on your right leg?
Okay.
Okay.
And then next, what we'll do is you can just stay right there. I'll just go right like this. So I'm going to be placing my hands on your feet. Are you okay with that again? And then all I'm going to do is I'm going to be rolling it kind of this way, like that. Okay? And then I'll be rolling it again, pulling you back this way. And we're just, again, like I said, testing those ligaments that are in here to see if they're stabilizing that ankle. Okay. So first we'll go this side. Okay. Any pain with that?
Yeah, there's a little
That
bit of pain.
pain on that outside same spot?
I'm
Okay.
just gonna walk.
And then we'll come right in here.
Do you have any pain while you're walking?
Any pain with that?
No, that's some
More when we increase.
That one's fine. So it's mostly like you said, going
Can you
in.
walk
Yeah.
down on
Okay.
your heels for me?
Good. Next one I'm going to do is I'm just going to test by squeezing up here near your calf. I'm just going to kind of squeeze in to see if there's any pain down here by your ankle. So I'll show you on this one.
Okay.
Is that okay?
Yeah.
So just kind of take here.
A little more painful? Okay.
Then I'm just going to squeeze. Okay. And then I'll just work my way down on the other side, and you just let me know when it hurts or if it even does.
Okay.
Okay?
We're gonna test how strong the muscle is. So I want you to first start on your left leg, and what we're gonna do is we're gonna do a single
Any pain?
No pain.
calf raise.
Okay.
The tables here just move to help maintain your balance.
Okay.
But basically what I want you to
And then next one I'm going to take your ankle again, and I'm going to pull it up like this.
Okay.
Okay. And then I'm going to rotate out that way. And then I just want you to let me know if that bothers you at all. All right? So come here on the same side.
you have much pain there.
No.
No, nothing. Okay. Good. So next thing I want to move into, Andrew, is just some of these treatments that we're going to do, because it sounds like you're in a little bit of pain.
Yeah.
So we want to decrease some of that pain. I also noticed there's a little bit of swelling here. And so we want to be careful with that, because ankles, and that's why they've been telling you to ice.
Yeah.
We want to keep some of that swelling and inflammation down,
Okay.
so that ice is going to be a good thing for us moving forward. We're going to do a few other things to help with that as well. So first, all I'm going to do is this one usually, patients like this one, usually helps their ankle feel a lot better. And I'll show you right here on this side, is all I'm going to do is I'm going to secure this part right here, and then I'm just going to pull, okay? Just small, okay? Can you feel that on that side?
Yeah.
Okay, so we'll go and do it. Go ahead and do it on this side. And let me know if this bothers you for some reason. You can let me know, but we'll just do this for 30 seconds.
Okay.
Okay.
I want you to know how that feels in your ankle, and then also.
Okay. How's that feeling?
Feels good. Feels like a little bit of the pain is going away.
Okay. Good. Okay. We do that 3 times for 30 seconds each time. Now, what I want to move into is, while we're down here, I just kind of want to feel around your ankle again. Just let me know if anything bothers it.
So,
As I'm going
what we're
through.
gonna do here for you to test first, just to make sure that,
Nope.
I wanna.
Okay, good. So you mentioned down right in there. Is that a little painful?
Yeah, that's a little tender.
Okay, right in there.
Yeah.
And how would you describe that pain?
It's
Cool if I place my hands on your legs, right?
it's not super sharp, but it hurts.
Okay.
Yeah.
Okay. One other thing I want to work on now is we're gonna have you sit up, and actually you'll be kneeling down on this table, and I'll show you kind of what it'll look like down here. You'll be like this with that right ankle forward.
Okay.
Okay. I want to improve some of this motion that it looks like because of this ankle injury, there's been a little bit of loss of motion there. We want to gain that back. That's really important for basketball players to be able to jump, run, stuff like that. So you'll be sitting like this. I'm going to place this belt on your leg here, and then I'll place my hand right here. And all you're going to do is, as I'm kind of pulling on that, you're going to just come forward with your knee, okay, over, and we'll go over and back, okay.
This side that hurts, or?
Let's go on your left first. Just to show you what it looks like. All right, we'll jump over just so you can get an idea. Okay. You feel stable in there?
Yeah.
Okay. Not dizzy from lying down too long?
No.
Okay.
I'm only 19.
You're only 19, right? You're a young pup. Okay, so again, like I said, I'll just be right here. Okay, and I'll be placing placing my hand there, and then as I pull, yeah, there you go. Yep, and then go ahead and go back again. Good, and then forward. Okay, does that make sense what we'll be doing on the other side? Okay, good. So I'll go ahead and switch over there. Is that okay on your ankle as well? That pad back there, is that?
Yeah,
full?
that's fine.
It's not like ripping the hairs out of your legs or anything?
I'm gonna come over to this other, to your affected side here.
So I'm gonna place there, and then again, go out, and back. Good, any pain with that? We don't want this to hurt at all.
Just a little bit of tightness.
A little bit of tightness, okay. When does it, how far out do you have to go before it hurts?
I'll tell you when. Right about here.
Okay, let's stop there.
Okay.
Let's not go any further than that. Okay. Okay, so we do that 3 times, 15 reps. And then what we'll do is we're gonna just test and see if that's improved a little bit. So I'll lower you down so you don't have to jump.
Right here.
I don't want you jumping on that ankle.
And then as we come pain out here.
Okay. And then let's just come down and we're just gonna do a squat again and see if that feels any better. So as you're standing there with those feet together, hands inside, I want you to just kind of, you can squat however you need to with your hands. You can bring them forward. Just go ahead and squat down.
How your ankle.
Okay, nice. Looking a little better.
I
Good.
definitely feel like I can put a little more.
Good. Good. So that's a good one for you. What we need to do though is we need to give you something that you can do at home, something similar. And since you might not have a belt or somebody to kind of pull on you, we're gonna get you one of these bands here. And all I'm gonna have you do when you go home is you can attach it to something stable, maybe your bedpost, or and then find something that you can step up on, box, and then you want to. So I'll take my shoe off to kind of show you. You want to make sure that this band doesn't come up high here. Those 2 bones on the side. You want to have that band down below because we want it kind of pulling on that lower part of your ankle or your foot. And then you're going to come out like this. And you can kneel down on the ground, and as that's pulling, again, we're gonna do that same idea, kind of moving that forward, okay? And then you can do that. Again, we don't want it to be painful, so if
Just like exactly
go
what we
to
did
that
too.
point, yeah, where it's not painful, okay?
Okay, let's test
You wanna
this
try it out?
Yeah.
Just like this. Yeah. And then below those 2 bones on the side of your ankle.
Okay.
Yep, and then you can kind of kneel down on your left knee. You can bring that up. Good. Yeah, does that feel okay?
Yeah.
Okay. And then come back. And that's kind of we're trying to simulate my hand, right? Pushing against that, except for this time it's with the band.
Oh, okay.
And then you'll do 3 sets of 15 of those twice a day.
Okay.
And that'll be everything, most everything I think today is 3 sets of 15 reps twice a day.
Okay.
If something hurts, remember again, we don't want to do it. All right? So we do that within maybe another set like that. Okay. Let's have you go. You know what? We've done some of our tests. We're moving into some of our exercises. I need you to lie on your back one more time. Okay, and now, because we're moving into some more strengthening things. And I want to test out, because we've worked on that. We talked about mobility and maybe getting a little bit more of that dorsiflexion. But let's see where your strength's at. And so what I'm going to have you do is, if you can sit up, at the edge of this bed right here.
Sit up?
Yeah. And then if you could hang your legs over, so bring your knees up to your level. Okay, so first what I want you to do is I want you to bring your foot up and in, like that. Okay, and all I'm gonna try and do is I'm gonna apply some pressure here, and I'm gonna try and move you down and out, okay? So don't let me move you, all right? Okay, don't let me move you, don't let me move you, don't let me move you. Good. Okay, and now I want you to go, so we did up and in, now I want you to go down and in. Okay, go ahead. Good. And I'm gonna try and pull you this way, but don't let me pull you, okay? Don't let me move you, don't let me move you, don't let me move you. Good, very nice. Okay, next what I want you to do is bring
And this is just a real quick,
your toes in that
screening,
way,
just
okay?
to make sure that you don't
And
have
then
all the main
I'm gonna
processes.
try and pull you straight out this way, okay?
Like the category that we
Ready?
normally have this,
Okay, don't let me
but
move you,
when I
don't let me move
push on
you,
your calf
don't let me
here,
move you.
do you have any
Okay,
like deep pain
and
in
then
that?
out that way.
Feels fine.
Okay, and I'm gonna try and pull you in this way, okay? Don't let me move you, don't let
And
me
then,
move you.
if I palpate.
Good,
your Achilles
good,
tendon,
good. Very nice. Oh, that was your injured ankle.
Yeah.
Awesome, you did well.
Thanks.
Let's move on. We don't need to test this one.
Alright.
It's the strong one, right?
Yeah, it is.
Okay, great. So, with that, let's have you now stand up. And I'm going to have you do a little test here to see how strong our calf muscles are, because they're obviously attached down there to that ankle. And what I want you to do is I want you to see if you can go more than 25 calf raises.
Okay.
Like that. Okay?
Just so can I face the
Yeah, you can face the table, yeah, for sure. Just in case you need to
I'm
hold
also
on
gonna
there.
do an anterior drawer test, so I'm gonna brace right here above your
4,
ankle,
good.
hold on your
5,
heel. I'm gonna kind of
6,
move your ankle a little bit. I'm gonna start really gently, and I want you to tell me if that's symptomatic or if it's on the same kind of pain that you're in here. Start with unaffected leg first.
Okay,
just
getting a
so
little
you know
tougher.
kind of what to
14.
expect.
Okay. Okay, 15.
That's about it.
Tired right there. Okay, 15. Take note of that.
That feels all right there? Okay. I'm gonna come do the same thing over here. I'm gonna be a little more gentle though, because I know this is your affected ankle. That's a little painful. Okay.
All right.
And it is a little lax or a little loose.
Okay, so we've got
on this side, so
our ankle exercise or to improve that motion, right?
palpate,
So what I want you to do,
and then we're gonna.
I want to do something that's kind of related to basketball, but I know you said jumping kind of hurts, right?
Yeah.
So I want you to do two sets of exercises here.
Okay.
First, very simple, where we're doing our calf raises, right? So you can do this on flat ground. You could do it on a step in your house, where we're standing there up on 2, okay, and down. So what I want you to do is 2 sets. 15 is where we got kind of tired, so we'll do 3 sets of 15. Sorry, fly in my throat.
Any pain there?
Any explanation needed for that?
So just
Okay, so let's
some
go ahead and do one.
calf raises.
Yeah, just like we just did. Okay, does that feel like 15 was hard for you? Do you think
Yeah,
that's
it's hard.
You can do 3 sets of 15 and do it twice a day, each day, every day, unless it's hurting you, right? We don't want that pain. We want to move without pain.
So,
Okay,
to jump to
and then the last exercise that I want you to do
the problem here
is,
has some
and now again,
instability. of
we
the
don't want
ankle.
pain, so you can grab a basketball. This is about the same weight as a basketball, but
So what I
you
want
probably
to
have
do
a
for our
basketball at home.
exercises or for our
And all I want you to do
ankles,
is that right ankle right here, okay, I want you to feel, and we'll just test this out, see if this is something we can even do. With that right ankle, you're gonna pick up like you're grabbing a rebound, right? And we're going to kind of push and shift our weight off of that and then go up like we're gonna go lay it up. Okay, but I don't want you to jump because that landing I think is bothering you. I just want you to come up on your toes. So here, push, up.
So first
Try and come up on those toes. So you can bounce, you can just have the ball in your hand. Here, up on those toes. Okay, so let's try again 15. Let's see how that goes on that. Yeah, so that right foot back, and you can just hold it, pick it up. Like this. Yep.
And I'm gonna pivot on my left side.
Yeah, so you're pivoting on the left foot, bringing that right foot forward. So pushing off that right foot. Obviously, if this hurts, we're not going to do it. So just let me know.
Is it okay if I go a little slow just in case?
Yeah, for sure. Try it out. Yep. And then up on those toes. Good. Yeah, perfect. Yep, with that. Those feet right underneath your base of support so you can go up.
Okay.
Okay, how does that feel? Feel okay?
Feels pretty good. Yeah.
Awesome. Awesome. Good. Okay, so that's something I think I want to add to it as well. We've got your ankle, right, where we're here, up on a step with your band, up, moving that knee forward, trying to gain that motion back. Okay, and then we also have our calf raises, right, where we're up here, 3 sets of 15. All these are 3 sets of 15. And then our pivot shift right where we're here, boom, up on there, 3 sets of 15. Okay, and then last thing we're gonna do is we're gonna just do a calf stretch. Okay, where you can go up against the wall.
Okay. So I'm gonna start real gentle.
Okay, and then you're just going to put that right foot back and just go
Yeah,
ahead
I
and
can feel that,
feel
right?
that?
Yeah.
Okay, good. And just stretch that for 30 seconds. Okay, we'll do 3 sets of 30 seconds twice a day as well.
Okay.
All right. You can work on both as well. Okay, any of those feel like, you feel like that's too easy, or you feel like you need more? Or do you
I
think
think
you
it'd
can-
be good to start off with, and
Okay.
I guess I'll report back to you after
Okay.
this visit.
And again, that swelling, we want that swelling to be down, we want that pain to be down. So what I want you to do is make sure, have you ever heard like RICE, rest, ice, compression, elevation,
yeah,
that
yeah.
thing? So make sure when you're at home, maybe put a bandage around that. We can send a bandage around when you're not working on it. Just kind of compress that. Make sure it stays elevated after you do your exercises. Ice it, okay, and give it some adequate rest.
Alright.
And then we'll see how it feels after. That sound alright?
Yeah, that sounds good.
Okay, awesome. Thanks for coming in, Andrew. I'll grab you some ice and then we'll get you out of here.